Dr. Bates, how you doing? This is Octavius Madden. This video is for abnormal psychology, of course, and today I'm going to inform you on obsessive compulsive disorder, otherwise known as OCD. Now, first of all, I'm going to go ahead and let you know this is going to be the most interesting video that you are going to view, so kudos to me. But to start it off, I bet you're wondering, OCD, obsessive compulsive disorder, what's that? Well, obsessive compulsive disorder is an anxiety disorder characterized by intrusive thoughts that produce uneasiness, apprehension, fear, or worry by repetitive behaviors aimed at reducing the associated anxiety or by a combination of such obsessions and compulsions. Now, obsessions are intrusions and mostly nonsensical thoughts, images, or urges that the individual tries to resist or eliminate. Now, a good example of this is saying, if you step on a crack, you break your mama's back. Crack, Crack, oh no, crack, Crack, no, There's another crack, No, Crack, 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 Imagine doing that your entire life. Your life would suck. Now, compulsions, these are the thoughts or actions used to suppress the obsessions and provide relief. Basically, there are things that a person feels may somehow prevent an event from occurring or push the event from their thoughts. Things like hair picking, skin picking, and nail biting are all on the compulsive spectrum. Some symptoms for obsessions are fear of being contaminated by shaking hands or touching objects that have been touched, and also intense stress when objects aren't orderly or facing the right way. But symptoms for compulsions are hand washing until your skin just becomes absolutely pink and raw, which is disgusting, by the way, counting in certain patterns, and arranging your canned goods to face the exact same way. Now, these symptoms usually begin gradually and vary in severity throughout your life. Symptoms usually worsen during times when you're experiencing lots of stress. Examples, marital issues, a new baby on the way, or a big exam for one of your classes. Now, OCD is far more prevalent than people once thought it was. I mean, in the year 2000, OCD was among the top 20 causes of illness-related disabilities worldwide for individuals between the ages of 15 and 44. OCD is also the fourth most common mental illness after phobias, substance abuse, and major depression. Now, OCD has been found to be the most common psychiatric illness affecting children and adolescents. The lifetime prevalence of OCD, 1.6% exactly. Now, most individuals with OCD are females. When it comes to the children, though, the situation is totally reversed. This is because the boys develop, or they tend to develop, OCD at an earlier age. The onset of age ranges from childhood through the 30s, with the median onset age of 19. The age onset peaks earlier in males than it does in females. The course of OCD is variable, ranging from episodic to chronic. It is agreed that both psychological and biological factors play a role in causing OCD. Biological factors include brain activity, neurotransmitters, and genetics. Psychological factors involve beliefs about obsessions, personality traits, and life experiences. People's interpretations of events are often a major cause of the emotional issues. The most effective methods of treatment seem to be those that specifically inhibit the reuptake of serotonin, such as, see if I can pronounce this right, clomipramine, which benefit up to 60% of patients with OCD. Now, the most effective approach is called exposure and responsive prevention. This is a process where the rituals are actively prevented and the patient is systematically and gradually exposed to the features and thoughts or situations. Neurosurgery is one of the more radical approaches for treatment for OCD. Some of the depressants or antidepressants that we use now are Paxil, Prozac, and Zoloft. After a specific surgical procedure, approximately 30% benefited substantially from having the neurosurgery. Neurosurgery is considered the last resort. And there you have it, Dr. Bates. My video, Obsessive Compulsive Disorder, OCD. I'm Rob Madden. Hope you enjoyed the video. Hope you're still awake. I know you had 100 videos that you had to view, but I hope mine stood out. But I'm not going to just close this video out by saying just bye or anything like that. I have a little song that I have to go along with the video, if you don't mind. It's a blues song, by the way. I wrote it myself. This is my imaginary guitar. I worked all night long. It's 3:38. I know I did good, so I hope it's an A. See you in class.